Here's my lesson in moving along the pain continuum and how it makes you in control. I'm Katie Podoretsky, a licensed massage therapist, and I love talking about self-relief for head, neck, and jaw pain so much that I've created online video courses teaching you how to address the muscular side of your jaw pain at home. I explain this continuum to a lot of my clients, so I'm going to share it with you guys. I want you to visualize this long line, and you can move along it both directions easily. On your left, you're going to be at a place where you're closer to dis-ease, not having ease in your body, where you might feel tight muscles, you might experience more pain, you might have not so awesome posture. If we're talking headaches and jaw pain, you're going to have more frequency of headaches, more intensity of headaches, or the jaw pain in there. Then moving towards your right, we travel towards more ease in the body. The motion is easier in our body. We have a more aligned posture. I'll never say perfect posture, but more towards better posture, supporting our bodies so it can work efficiently. We're gonna have a little less pain here. Even as you come through here, decrease in that frequency in jaw pain and decrease in the intensity as well. So you can think of it as you can travel back and forth along here. Now, right now, I don't want you to pick where you think you fall on this, because if you don't have a self-awareness in your body, you're not going to really pick that spot right, I found. So when you experience something, when you're going to change or adjust something, for my clients, this would be, we do this sort of before and after a massage session. You could do this before and after stretching, just creating a place of self-awareness. So for instance, if we're talking about a neck moving easier and having ache in the head, we'll have a client sort of feel their body and get a sense of what that's like. Okay, it's a little stiff. I feel this sensation up here arching around my ear, hanging out around my eye, where they just identify where that is. Then we do the body work. Then after that, they feel their body again and they're aware of it and they listen to it. Oh, that's easier. Oh, gosh, I didn't realize my shoulder was achy, but it feels better now. But before, I didn't realize it was achy. So you'll notice a lot of that, like things that you thought were okay and acceptable before, and then you're like, oh, well, that feels better. And maybe that ache around here is. So now that you have two things to compare, you could start putting some dots on the timeline or on that continuum. So like maybe before, I can now identify what's here. After I did an intervention, I moved here. So as you go through your life, you'll sort of be able to develop more points or develop how these points are after you do certain things. And that's where it gets awesome. So you get to figure out what's empowering when you do good things for your body or your mind, and your body you move these points, or you feel more on the continuum towards the healthy side, the more ease in your body. For instance, I kicked sugar for a week. I'm moving in this direction. So now maybe you want to do more of that. I really hydrated well and stretched last night, and I woke up feeling more this way. Normally, I wake up feeling more this way, in the dis-ease. So you get to figure out and feel empowered of how your choices can pull you along the timeline in either way. It can go true for going the opposite way. So if you know what your bad habits of use are, I talk to my clients a lot about sleeping postures, and you can learn a little bit more about that with my free video. But if you're falling asleep on the couch after a few extra beers and watching a movie and you slept on the couch a long time, you're going to wake up and you're going to be over there. And you're going to remember, oh, I don't like that. And you're going to make better choices in the future so that you don't feel that and you're going to use some of those good choices to pull you back. You'll figure out what can move you in both directions. As you figure this out, it's not an opportunity to shame and blame. Knowing this timeline and seeing yourself move on it is no place for shame and blame. It's just recognizing what control you can have on your body. It can be really empowering if you've had an acute or chronic pain, and just those subtle shifts could give you some respite, or identifying what things have been taking you in the negative way, so that you can undo those and get a little better towards where your goal is. So much like you're not allowed to shame and blame, you're not allowed to compare your spectrum with anyone else's. So if you're a person in chronic pain, in no way, shape, or form are you allowed to compare your spectrum with someone who's outrunning a marathon every week. Just don't hurt yourself that way. So I really hope that thinking of this spectrum will give you that sense of agency again. If you'd like to learn more ways to intervene and know what to do on moving on that timeline, I encourage you to go visit my online courses at Help Head Pain. There is also a free video lesson that you can get. I will share one muscle that gives headaches and jaw pain and pain in the ear, then tell you how to massage it safely, as well as give you one habit to change to bring you towards the better place that you want to sit, of more ease in your body.